Hi there, my name's Jo. I want to tell you a little bit about my interest in integrative oncology. So I've got two qualifications that I'm going to tell you about. The first one is in functional medicine, and I graduated as a functional medicine practitioner back in 2013. So I was the first UK practitioner to graduate from America, and that was because my passion was always to ask this really important question about people when they get sick. And that question is, but why? Why has somebody been diagnosed with cancer? Why has somebody been diagnosed with an autoimmune disease? Why has somebody been diagnosed with cardiovascular disease? What is the why behind? And I sort of went on this journey when my own daughter got sick in order to get that but why behind. And then I would say that my calling has always been to support people with cancer. And that's why I traveled back to America to train as a fellow in Integrative Oncology. So that's my title. I have a fellowship in Integrative Oncology. What does that mean? It means that I support clients alongside their conventional journey. I'm working to optimize the environment within their body, which at point of diagnosis has been an environment that has been pro-cancer growth. It has allowed those cells to mutate inappropriately. So we really want to think about changing the terrain. The terrain is everything when working with an individual who's got cancer. So why have I come to talk to you about this today? Because during this outbreak of COVID, then I have had multiple conversations with clients, particularly my stage 4 clients whose cancer treatment has been stopped or has been warned it will be stopped in weeks to come. And that really does come down to, well, two factors. One is the dangers of being neutropenic during the outbreak, the pandemic. And the second one is due to staff absence. And sadly, prioritizing the staff that are in the workforce and how that priority hasn't been made for stage 4 cancer clients. It's heartbreaking. And I know if this is you or your loved ones, that anxiety that everybody is feeling right now is only going to have intensified millionfold. So why have I come to talk to you today? No, I can't reinstate that treatment. But what I might be able to do is to give you alternative strategies to be working on during the pandemic, which actually works to alkalize the body, which works to change the terrain, which works to deal with your stress and your anxiety, which works to reduce factors that were there all the way through your diagnoses that could have perpetuated cell growth, and at least empower you to be in a position that you are still doing something. You're still being proactive, even though your opportunities have been reduced. So no, we can't control the world. We cannot control the pandemic. But what we can control is our reaction to that pandemic. And where you're concerned, then your need to react to that in a slightly different way is intensified by your original diagnosis or the diagnosis of one of your loved ones. So I want to remind you that there are still options, that there is still mechanisms to make a difference, even though your fear factor is higher than ever before. The big C, we've always talked about it with regard to cancer. We're now talking about the big C with regard to corona. And for those of you listening, you might be facing a double C going on right now. But I'm here to support you. I'm here to guide you. And together we will come out the other side of corona. So if you're interested, if you need that extra support, you drop me a message and I'm here to support you. You take care.